Hi, I'm Magdalena, and of course you know the famous Matthew Millard. So we're going to go through a stretch. So the stretch for you will only take 10 minutes or even 15 minutes. Depends on how long you want to go through the stretch for. I'm going to explain what it is. It's controlled articular rotations. It means that you go through the joints, there'll be about 10, and you'll go through rotations to your capabilities, to where you can go with your rotations. So with this, there's going to be a few things. Matthew, being our model, will go through what I would like you to do. Just a couple of things that you have to take care of first. When we do go through our rotations, I want you to just be aware, like for cervical spine, if you find that when you do the rotation and you get a pinch on the closed side of the rotation, I'll give you two options. But first of all, this is the closed and this is the open angle. If you feel anything on the open angle, that means you're feeling that stretch, so that's okay. If you're feeling a pinch here, that's not okay. What we can do for you to move around that is you can feel that pinch here. You can either just move away from that pinch and then go out of it and then rotate again. If you feel the pinch again here, you can either tick-tock back, like you'll feel that pinch and then you'll just reverse back out. I'll show you with Matt in a minute. So Matt, if you'd like to just face the camera. So I would just like you to just extend your neck and rotate your chin towards me, towards your right shoulder. So say, stop there. Say he finds that he's got a pinch right there. He'll draw his chin back to his chest and then rotate again to the left shoulder and then go back to where he finds that pinch again. So extend again back. He finds the pinch and then he draws his chin to his chest and he goes back again. So you're fine. You're not actually going through that pinch or that pain. And the other option is, and just extend back again to where that pinch is. He feels the pinch there. Then he's going to actually go to his left shoulder and tick-tock back. So extend back again. So what I mean by that, he feels the pinch there and he's just going to tick-tock back like that. So go again. And tick-tock. Extend and then rotate to your chest. Yeah, perfect. And then back again to the left. So that's what I call the tick-tock. Thank you, Matt. Got carried away with that one. So we'll go through what to do when you're going through the rotations. When I talk about radiate your body, it means that I want you to put tension. So if he's going to do his cervical spine, he'll make his body nice and tense and isometrically tense. So what I mean by that, he's going to put tension in his arms, tension in his chest, squeeze his glutes, tension in his legs, and you can even squeeze your toes as if they're grasping on the floor. And all he's concentrating on is his neck. So you can do that rotation. So flexion first, rotation, extension, lateral flexion, and that's fine. So that's what I mean. He's radiating 40% throughout his body, and he's going to concentrate that rotation around his neck about 30%. So when you are talking about isometric tension, or when I'm talking about isometric tension, it means just tensing the rest of your body as if it's stuck in cement and all you're doing is just concentrating on the joint that we're rotating. When I say pack that air down, he's breathing and he's packing that air into his rib cage so that you become solidified. That when you're doing the hip rotation, you're going to feel like these hips have got headlights on and they don't move and they're looking forward. So you don't get any kind of compensation when you're rotating. But as we go through those steps, I'll give you more of an indication of what it is. So we're going to start again controlled articular rotation car segment for your stretching. So this is what we're going to do. We're going to start with our cervical spine. For some of you that don't really know about the terminology, I'll just give you a quick rundown. Flexion is forward. Extension is back. Lateral is to the side and right side as well. And rotation. Okay, perfect. So they're just the things that I'm going to be commonly talking about so you have an understanding of what we're saying. So I want you to now you can also hold on to some balls to give you more added tension so you're not putting your nails through hands. I'll grab a block. You can use balls or you can use a block to hug, and we'll show you how to use that in a minute. So first of all, I'll show you and then I'll get Matt to model it through. So when I talk about cervical rotation, we're going to pack air into our rib cage. We're going to tense all of our arms, our chest, our glutes, our legs and our toes on the floor. Okay, so again, I'll just show you. So we're rotating flexion, lateral extension, rotation, again back to lateral, and then rotate. Let's start our cervical rotation. Again, before we start, pack that air down, tense the arms, tense the glutes, legs tense, and the toes clamp. Okay. Flexion, and rotate to the left, all the way back, extension, all the way back, and one more rep. Go a little bit slower, and you want to really scrape and go as big as you can, but without compensating your hips or moving any part of your body. Go the other way, rotate the other way, and you can do as many reps. I always say about 2 reps per side. And again, you can see Matt not moving his body, not moving his shoulders, and he's staying really still with his body tense, just concentrating on the neck. And that's fine. Okay, perfect. So now we're going to start with our spine. So you can either cross, I like to cross my hands across the chest so that you don't have any compensation. Don't have any compensation. Yeah, there he just wants to use his biceps. Okay, so this is what it's going to look like. Again, we're only concentrating on the spine, and we're only doing the rotation, keeping his hips down with his headlights moving forward and with not any kind of movement around his neck. It's all spinal. Okay, take a deep breath in, pack that air down and tense the glutes, arms, legs, and off you go. Flexion, tense and go forward, go left as much as you can. Now you might not be able to do as well as Matt. Go rotate to the left, nice and slow, without compensating your hip. Go extension all the way back to wherever you can, as far as you can without using your hips, and come rotate to the right, and you can see, and rotate, rotate. Perfect. And we're going to go one way, one more rep to the left, extension, lateral rotation, rotate, rotate, right across without moving his hips, and go forward and tick-tock the other way back. And you can see Matt's doing really well without any compensation of the hips. Rotate, rotate, rotate. And perfect, that's it. And you can relax. And it actually is quite difficult, isn't that right?
Yeah, sure.
Because you actually want to get as much flexion, as much rotation, and as much extension as you can, keeping everything quite tense and without any compensation. Okay, so now we're going to go into scapula. So if you turn around, Matt, I'm going to show you what we want to move. We want to move. Matt won't take his shirt off, so we have to just see what we've got here. So we're just moving that scapula. Now, the shoulder will come into play, but we're actually wanting to use and just concentrate on the scapula. So we're going to think that this is the 4 movements. If I talk about a compass, we've got 4 cardinal moves, 4 points. And what I mean by that is that we're going to move it 4 ways. We're going to go into elevation, so north, up, down south, east being in, and then west being out. And then we're doing that in a nice, so we segmentally did that, but we wanted to make it a fluid movement. So what I'll show you to the side here, if you move to the side. So I didn't mean to move across. So what we're going to use is our hands, and how we're going to judge that is your middle finger, your index finger will be on the pant line as if he's got an imaginary line down his side of his leg. And all he's doing is he's going to concentrate moving the scapula, and his finger will be in line with that pant line so that you know you're not compensating your shoulder. All you're doing is just moving your scapula, and we'll show you this. Pack that air down, take a deep breath in, tense the body, and we're going up north, forward, down, back, up. And as you can see, he's not moving that finger and he's not using his shoulder. All he's using is this shoulder, is the scapula right here. So you want to try and get as much fluidity without compensating any of the side. And you can then do the other side. So you'll go two reps forward one way, and then you'll reverse that as well. So we're going to do it, so just show you back. And we're going to show you both hands at the same time of how it will look. Okay, take a deep breath in, pack that air down. We're going to go elevation, so going up towards our ears, forward, back down, all the way back. And he's following that finger line and not going anywhere or using his shoulders at all. And reverse that, back again, go forward, up to his ears, all the way back, down towards the floor, and forward. Up as high as you can, and back down, and relax. Now, Matt's really good and he's got very good rotation, so don't try to feel that you have to go that full range. Just go within your means. As you do this every morning and as you do it even at night time, you'll just get better. It's just something that you do every day. So now we're going to go into hips. So if you face the camera, I'll just show you first. So again, you can hold on to a stick or a dowel. So you will, I'll just hold on to Matt. So you'll go, we're just going to use our hips. You're going to bring that leg forward across the body, up into flexion, outside, and I'm not using this hip at all, and you'll only go to where your range will be. And coming up. The whole point of this is to get as much rotation without any compensation. You need to radiate as much tension in the body as you can and just concentrating on your hips. Okay, so you can squeeze and we'll bring that ball back out. Okay, so we'll take that leg across, lift that leg up, radiate, come across, and again you'll see his hips are not moving at all, they're keeping still with his headlights out in front, extension, take it out all the way back, and back in towards the other leg, in, one more rep, go forward, across, flexion, extension out to the side without compensating, because you can make that circle bigger if you use your hips, but that's not what the aim is. Come out. So Matt is leaning a little bit, as you can see, and then now we're going to reverse. So take it out, radiate 40%, tense that body, pack that air down, and then come back. So we're going to go reverse, without keeping still, take it out, extension, out to the side, it's out, as much as you can, yeah, there is your rotation. That's as much as he can do. Then out, and then reverse back in. All the while keeping your body still. And he's got a little bit of a slant, so again, he's not so good at that one. All right, so now we've done the hips. Now we're going to go into the shoulder. So when I say, or when you actually go into extension and rotation with your shoulder, you're going to come across the body and you're going to see your bicep. I want you to try and swipe your bicep across your chin, and I want you to imagine that there's an X on your bicep and you want to rotate it away as far as you can. Not just the hand, it's actually the rotation of your bicep away without compensating your body and leaning it and trying to make that circle bigger. Then you'll come back up, bring your X or your bicep back to your face, swipe it across the chin, and then go 1 or 2 more reps. And I'll show you with Matt. Okay, take a deep breath in, pack that air down, tense the rest of the body, glutes, and bring your arm across and over. Swipe your bicep, and you want to try and remember there's an X there, so you want to rotate that bicep away as far as you can without compensating. Come back, all the way back, forward. Go 1 more rep forward, keeping that air and the arms tense, swiping it across your chin, rotate that X away as far as you can, all the way. You really want to get that movement around that shoulder capsule. And then now we're going to tick-tock that arm back, reverse, rotate it, good. Bring that X on your bicep across your face, and then bring it back forward again. Rotate that bicep away without compensation with the rest of your body, and relax. And that's on one side, and then you repeat it on the other side. And you get better. If your range is here, that's fine. You're only going to get better each time you do it every morning. So don't worry about range at the moment. Just worry about where you can fit it in. If you feel again that pinch, remember this is the closed angle. If you feel that pinch, move away from where that pinch is, go out of it and then come back in. Or you can just tick-tock yourself away before you feel that pinch.
So that's same with pinching or clicking?
Pinch and clicking, correct. Yeah. You don't want to ever go through that pain threshold of any pinching or any clicking. So I want you to imagine that there's this dense air and you're actually working against that dense, thick air. So you're going to just work your forearms, and you're going to imagine like there's a armpit. We've got an elbow pit right here. There's an elbow pit. So we're going to work just on our elbow. So what I like to do so that you don't get your shoulder in compensating for your forearm work, I'm going to get you to hold that indentation, yep. So hold the bicep, sorry, yeah. Okay, so again, we're going to start in that's supination, and Matt's probably taught you all what supination is. It's like having soup, and that's pronation with your palms down on the ground. Okay, so we're going to start relax by your side. Take a deep breath in. Everything is tense. Don't forget to tense the body. Okay, so you're going to bring your forearm up as if you've got this thick, dense air, slow, and you're really struggling against it. And then now you're rotating down, not using that, and there he is. And then you're pushing that dense air all the way down to the ground. It's tense. All you're doing is just trying to get as much rotation and pushing that air down, down, down as much as you can. And then now bring that supination, rotate, only without using your bicep or the shoulder, and then bring it up again. And then we're going to do the reverse. We're going to keep it supinated and then go down. So you're really trying to push that thick, dense air all the way down. Rotate again, rotate into pronation. Push that dense air up without using your shoulder. Perfect. And relax. Now you can do it if you want to, if time's poor, you can use both arms, but you really want to concentrate that you've got tension and that you're not compensating with your shoulders, and then you can go rotate. That's if you're time poor, you can do it on both sides. So we're now going to do wrists. So what I like to do, you can have it flexed or you can have it closed. I'm going to show you both. So we're going to have our wrists open. Now some people are going to struggle with this because they don't have any range of motion in their wrist. And when they try to do rotation, they'll use their fingers and curl it up. So we're going to try and show you what not to do. Okay,
I can do that.
Okay, take a deep breath in, pack that air down, and we're concentrating. It's like you're moving thick air. So go flexion without using your fingers. Now you can use that hand and close. No, you can use that. So yeah, because you don't want to. You want to pretend like you've got a hot coffee there, and you're not going to drop it. So Matt, you don't want to drop that coffee.
Never drop coffee.
Okay, so right, without curling your fingers. And then back around. So see how he's curling his forearms. So what you can do there, Matt, I'll just show you. So we can go internally, up, thumbs out, back around. Some people, so again, not using, so that laterally, some people are going to struggle. That's going to be easy, that's going to be difficult. So as again, people will try and compensate and use their fingers and curl it up to try and get extension, flexion, but don't. To save you from doing that, you can wrist, can be fingers, yeah, exactly. Make a fist and then do laterally rotate, go out.
That's it.
That's it. Rotation, and then go down, you go down and then in. And then curl, and then out, and then go the other way. I can hear it kicking. See how he's not using his forearm, it's all wrist. And especially if you've been using the mouse, you know, this is really good to get some flexion, extension in that wrist if you're always using the computer or texting.
It does make it a lot easier with the fist closed.
Yeah.
It's a visual to see
it's
what
a
I'm
visual.
doing.
Okay, well there you go. Matt's just said that he prefers the fist closed. And he's just continuing on. I think that's okay. There you go. Let's take a seat. So what we're going to do, we're going to, if you bend one leg, we're actually done the hips. And we're now going to work on the tibia. So when we do the concentration of our tibia, there will always be some compensation with our ankles. But we can change that by just looking down, and you can see and you can watch. And this is how we'll be holding it. You can see the tibia moving, and you can actually rotate it, extend it, rotate it internally, and then bring it back down. Now, what we don't want to see is the femur moving or the upper thigh. All we're wanting to rotate is the tibia. So I want you to just watch Matt as you brace that tension. Okay, so we're going to externally rotate, raise it up, and then go up, extend the foot. Don't lock out, internally rotate without moving the knee. and then go back into flexion. So not the ankle, we're just concentrating on the tibia, so go down and extend it out, externally rotate without moving the knee. So he can actually hold on to that knee so it doesn't play any part in the movement. So again, externally rotate, extend. So we're only looking at that, we don't have to worry about the ankle. Go up, internally rotate. So we're looking at the tibia without that knee bend, go back down into flexion, and then go one more rep out, because Matt needs it.
I really needs it.
And then extend.
I can't do it.
Yeah. And then internally rotate. And then back down. And now we're going to go reverse. We're going to internally rotate back out. We're in position. And externally rotate the tibia, the tibia, the tibia.
Or we're not.
We're not. It's not actually happening. And then go down. Okay. So I'll just show you because Matt found that difficult. So we want to hold on to that kneecap because we don't want our knee working. It's just that tibia. So we're going up, internally rotate, back down. Go up, external rotate, go down. Does that make sense?
It makes sense.
Okay, so you'll do that on the other leg as well. So really all we're wanting to do is just have that tibia moving, and because we don't move it, it's not so much the knee. Okay, so now we're going to do the ankle. So the ankles are, because we don't want to, we actually don't want to have any compensation with our tibia. This is all about ankle, and you'll find that you'll only have a certain amount of range because we don't actually going to concentrate on ankles. So again, you're going to internally rotate, and I like to also hold on to my tibia because I don't want the tibia or the knee or the thigh to come into action. It's just the ankle. So again, you're going to internally rotate. So internally rotate, do a rotation, flexion. Laterally come out to the side, go forward. Get as much range as you can. And now reverse tick-tock back. Oh, we've got a crack. Okay, and that's perfect. And the last one is our toes. So it's really important to get the ligaments underneath our feet working and getting all those muscles nice and activated. It does carry our weight, so giving them a bit of love and care and a bit of attention goes a long way. Okay, so what we're going to do is we're going to lift our toes up and just the big toe down. Just the big toe. And now the rest of the toes. Big, all toes up, big toe down, and then the rest of the toes. And now we're going to leave the big toe down and lift the toes.
Are you joking?
And then now lift the toes up. He's going to cramp soon. And now lift the big toe up and take the toes down, leave the big toe up in the air. And he's finding it very difficult. Let's go one more rep.
Everything?
No, just big toe down, 4 toes up. And now the big toe up. It's because he's English, I think. Okay, and back down. Now we're going to do a little Mexican wave. So we're going to start from the little toe, all toes up. And now we're going to start with the little toe down, and then the big toe, and then Mexican wave. And then is that working too? They're supposed to be in sync. Okay, all toes up, Mexican wave with the pinky, and then the rest follow, but Matt's toes, big toe wants to work at the wrong time. So that's a work in progress. We'll see soon down the track.
That's a fail, people. That's a fail.
So that is our full body. So really, I would suggest doing 2 to 3 reps. One way, do 2-3 reps the other way, and then just really get a feel for how much rotation, what your limiting deficits are and then work on them. The more you do it, the more you're just going to get better and the more rotation. And I mean, I don't know how you feel after just doing a little
Exhausted.
bit of that. It is exhausting, but do you
hard.
feel like, I mean, for me, when I do cervical, I always feel like clicking, and I feel like there's just a lot of sticky spaces I have on my neck. I don't know about you, where you felt any kind of...
Yeah, my neck's not too bad and shoulders are okay.
Yeah.
Lower
Hips?
body, obviously, yeah, hips were hard for me.
Yeah.
But just feeling the joint go through that full, or your full range, as it currently is really, I feel more open as a consequence of doing it.
Yeah.
And it feels a little bit more lubricated, if that makes sense.
Yeah, yeah.
I can move more freely.
Yeah.
So it's amazing how hard some of the movements are.
Yeah, exactly. And you know what, with our hips, we want to create space in our joints so that you can get really good synovial fluid in between those joints. We want movement. I mean, especially our hips, they're supposed to move in rotation, especially our joints in our shoulders. Our spine's supposed to move laterally. You know, just everything. We get so stuck into sitting down in a seat and not moving in the directions that we're supposed to move. If you've got any questions, let Matt know, or you can ask me through Facebook or text. So I hope you enjoy it. If there's any questions, let us know. Enjoy!